Thank you, everyone, for being here at the teach-in. And I'm going to share my slides so that we can go ahead and get started. So, as I said, thank you, everybody, for being here today. We're going to be talking about the U.S. healthcare system. This is the first of a series of teach-ins that is sponsored by the Bay Area Coordinating Committee, Senior Disability Action University, and National Single Payer. The title of this presentation is "This is Not Normal," and hopefully you will understand why it is that we have a not normal healthcare system and what a normal healthcare system could look like. So, patchwork healthcare coverage, which is what we have in the United States, is not normal. I like to think of the US healthcare system like a pie, and about half of the pie that is in blue are the 160 million Americans and their dependents who are tied to their jobs or marriage and get employer-sponsored health insurance. In that orange slice of the pie, we have the 20 million individuals who live in families that pay monthly premiums for private insurance in the marketplace, plus deductibles of up to $18,900 per year before their insurance kicks in a penny. Now, in the yellow slice are the 69 million individuals on Medicaid. These are poor people and their children who must prove their poverty month after month to qualify for Medicaid. In the red slice are the 65 million Americans on Medicare. And we know that as working Americans, we must pay a tax every 2 weeks for health care that we must be 65 years old to enjoy when we become eligible for Medicare. And that half of the taxes that we pay our entire working lives go to corporations. Now, in that very small slice of the pie, in that green slice, are the 9.1 million veterans who have the best socialized medicine, that is public financing and public delivery of healthcare through the Veterans Health Administration. And that leaves the purple slice, about 26 million individuals in the United States who are uninsured. Now, another way of looking at our healthcare system, really, we have no healthcare system. What we have is a healthcare arrangement. So here's another way of looking at the pie. By the way, most of us spend our entire lives sliding from one slice to another on that U.S. healthcare system pie until we finally end up on Medicare, hopefully at age 65. So this is another way of looking at it. And we see that about 110 million Americans in this purple slice have medical debt. And most of Americans who have medical debt have health insurance. Now, in that orange slice, as a result of our patchwork arrangement, about 100 million Americans are either uninsured, have insurance gaps, or are underinsured. And finally, that leaves the rest in that light green slice with adequate health insurance, about 115 million, or 1/3 of Americans with adequate health coverage and no medical debt. Now, we regard this as normal, but what we're saying is that this is not normal. Now, how did we get here? Well, there have been many social forces that have shaped U.S. healthcare policy, and I'm going to just start with Jim Crow, that was responsible for shaping the ultimate creation of Medicare for good and for bad, and the pervasive racism that persists today in the United States. That's also shaping our healthcare policy. Now, the Red Scare, this is the fear of anything European with communism or socialism, also shaped U.S. healthcare policy, as has this faith in American capitalism that has led to the growth in our for-profit driven healthcare system. Employers have used health benefits to control workers, and unions have also used health benefits to keep workers in unions. And finally, providers, mostly physicians, have used their influence to protect their status and compensation. Now, the US not normal health arrangement comes from something called American exceptionalism, which is defined as if it worked, we would have already done it. And this American exceptionalism has allowed the US to double down on the market. This faith in capitalism has resulted in a profit-driven healthcare financing and delivery system, as we shall see. And this has given rise to the inevitable rise of health systems, huge health systems, huge insurance companies, big pharma, integrated systems of larger systems gobbling up smaller systems, middlemen spin-offs, and the privatization of public systems such as Medicare, Medicaid, and the Veterans Health Administration. Everyone profits in this so-called system or arrangement except the people who pay for it. Now, kleptocracy, which is defined as a society or system ruled by people who use their power to steal their country's resources, is not normal, yet we accept it as normal. From 1975 to 2023, the US had a $79 trillion wealth transfer from the bottom 90% to the top 1%. If earnings were equitably distributed at pre-1975 levels, the average worker at the bottom 90th percentile would earn $32,000 more annually. So while kleptocracy is not normal, we accept it as being normal. Now, since 1999, the cumulative increase in earnings have gone up 64%. So if you add them up year after year after year after year from 1999 to 2017 and even to today, earnings have gone up 64%, just barely above inflation. If you compare that to premiums, health insurance premiums, these have gone up 224% in the same time period. So flat salaries are due to increasing health insurance premiums. This is not normal, yet we accept it as normal. If we were to look at the US national health expenditures in billions of dollars, from $0 to 5,000 billion, which is $5 trillion, from 1973 to 2023, we would see that back in 1973, our national health expenditures were $550 billion. Now, they had been going up since the passage of Medicare in 1965. So President Nixon at the time, trying to control healthcare costs, introduced for-profit managed care. Now, this was known as Nixon's HMO Act, or Health Maintenance Organization Act. In 1980, President Reagan introduced more deregulation and fiscal restraint in healthcare and also added penalties for drug offenses. In 1997, President Clinton added Part C in Medicare, which was basically Nixon's HMO Act, into Medicare, allowing the privatization of Medicare and Medicaid. And this introduced Medicare managed care for the first time. President Bush added Part D to Clinton's Part C in Medicare and renamed Part C, Clinton's Part C, as Medicare Advantage and opened up the gates wide open to private insurance companies to really rev up the privatization of Medicare. In 2010, President Obama signed the Affordable Care Act, the Patient Protection and Affordable Care Act, which was neither protective of patients nor affordable. And that leaves us in 2023 with our national health expenditures of being $4.8 trillion. So from 550 billion in 1973 to $4.8 trillion today. You can see that all the efforts by these presidents to try to control costs have done the exact opposite. Now, profiteering is bipartisan because Republicans and Democrats have been responsible for this. President Nixon was the father of managed care. President Clinton was managed care and Medicare and Part C. President Bush gave us Medicare Advantage. President Obama signed the Affordable Care Act, which expanded Medicaid, but also gave billions and billions of dollars in subsidies to insurance companies. And then our slash and burn president is kicking 15 million individuals from Medicaid and kicking them off Medicaid, meaning that they will be uninsured, resulting in over 16,000 medically preventable deaths per year and the closure of hundreds of rural hospitals. Now, for these presidents, Democrats and Republicans alike, business always comes first. And any attempts to lower costs have had the opposite effect, with more opportunity for more profit. Now, compared to our peer nations, the US healthcare overspends and underperforms. So let's take a look at this chart here. And by the way, all of these slides have references at the bottom, even though it might sound like I'm making this stuff up, I am not. So if on the y-axis we look at lower performance at the bottom, going all the way up to the highest performance on the top, and compare that to lower spending on the left and the highest spending on the right, we can see that our peer nations such as Australia, Netherlands, the UK, France, Germany, Sweden, Canada, and so forth have good high performance at about middle spending. And the United States, however, has the lowest performance and the highest spending. So we are not getting our $4.8 trillion worth of in our healthcare system. We definitely are not getting our money's worth. Now, profit over patients is not normal. Healthcare is a $4.8 trillion industry, yet 50% of working age adults find it very or somewhat difficult to afford healthcare costs. Revenue of the largest 7 insurance companies was $1.25 trillion in 2022, yet 40% of working age adults skip care due to costs. And private equity invested $1 trillion in healthcare over the last decade, yet private equity acquisition is associated with a 25% increase in adverse patient outcomes, including higher mortality. Profit over patients is not normal, yet we accept it as normal. Profiteering over healthcare is not normal. The arrangement that health insurers collect money from patients and employers to pay for care through premiums and taxes is really a scam, because health insurers keep the money but deny and delay paying for care to make a profit. That is their business model. Now, this is not normal yet. We accept this as normal. Now, every year, Modern Healthcare, which is an online journal read by our health industry people, puts out the 100 most influential people in healthcare. And this was their list in 2024 of the people who were the most influential in healthcare. So coming in at number 18 was Jim Rechkin, president and CEO of Humana, whose compensation in 2024 was $16 million. Coming in at number 7 was Gail Boudreaux, president and CEO of Elevance Health. Her compensation, $20 million. Coming in at number 6 is David Cordani, chair and CEO of Cigna, compensation, $23 million. And coming in at number 1 was Andrew Whitty, the former CEO of United Health Group, whose compensation in 2024 was $26 million. Now, a system that extracts profit from sickness while abandoning those who need it most is just so not normal. Now, when it's not about health, but about profit, it's not normal. And we have to start seeing it that way. How have we allowed this to happen? Well, we've treated healthcare as a commodity, not as a public good. We've transferred control of a public good to private hands. We've created complex incremental steps that add profit-seeking middlemen and gave these profiteers power over our health, our tax dollars, and our income. Now, how profiteers profit in our not normal system is pretty striking, but this is how it happens. We have private insurance in the middle here, and they get money from the federal government from families and individuals through premiums, from state governments, as well as from employers and corporations. And they collect all this money and deny and delay care as much as possible. They build these huge administrative complex rules, and which are needed to generate their profits. And then they do pay from this big pot of money. They do pay some. They pay the hospitals, the doctors, the clinics for prescription drug costs, for pharmaceutical pharmacies, for nursing homes, and for hospice. They do pay these providers, as they're called. But these providers are owned by the very same private insurance companies, as we can see in this graphic. So basically, they're just paying themselves because they own the delivery system as well. Now, what they do pay out are for the politicians who write the laws that keep the system going so that these corporations can get richer and richer and richer and enrich the politicians that write the laws for them. Now, we must eliminate all profit in healthcare financing and delivery. Now, that's normal. What is normal? Well, national single payer, Medicare for all, free from profit, because it would reduce costs. It would save $450 billion per year. That's 13% of our national health expenditures. There would be no copays, no deductibles, no premiums, and no out-of-pocket costs. It increases administrative efficiency and reduces overhead. It improves services for uninsured and underinsured, including the insured. It slashes pharma pricing by 40%. It saves lives and rural hospitals. 338,000 COVID deaths could have been averted with single payer. And 68,000 people would not die unnecessarily every year if we had national single payer healthcare in this country. And national single payer can protect rural hospitals from closing. Besides, Medicare for All is supported by almost 60% of Americans. Now, this is normal. But everybody asks, how will you pay for it? Well, here's a little cash register, and this is how it would work. There would be a progressive income tax starting at 1% for low-income earners, up to 11% for the highest income earners. There would be a flat payroll tax of 1.65%. There would be a corporate profit tax of 15% and a wealth tax of 3% on individuals with assets of greater than $30 million. Taken together, this would raise the $1.6 trillion necessary in taxes to pay for national single payer. And these taxes would replace what we currently pay in premiums and copays, deductibles, and all other medical bills. Now, how much would you save with national single payer? Well, there just happens to be a handy household savings calculator that you can look up, and you can plug in how much you and your family pay, how much your employer pays, and what it shows that nearly 9 in 10 people will save money, more than $5,000 per year on average, with national health insurance, with national single payer. And here is a QR code. You can go ahead and take a photo of it, and it'll take you to the website, and you can plug in your numbers, your employer numbers, and then hit submit and find out how much you and your family would save every year under national single payer. These are the guiding principles that serve the people. Our government must recognize that healthcare is a human right. We must ban private health insurance and for-profit delivery of care. We must transform healthcare delivery from profit-seeking ventures to services that serve the people and frees caregivers from corporate control. We must enact a publicly financed national single-payer program free from profit that provides comprehensive coverage to everyone. Now, there are 2 bills in Congress right now, one in the House, one in the Senate, for national single payer. And I'm going to talk about Representative Jayapal's improved Medicare for All health insurance program that was just introduced this year again. And it's HR 3069. And it would give us comprehensive medical benefits, including abortions and reproductive freedom of choice. There would be no private insurance premiums, no copays or deductibles. We would get long-term services such as nursing homes and supports through home and community-based services. It would allow Medicare to negotiate drug prices, unlike right now, but it does allow investor ownership of healthcare, and this needs to be improved. Now, if you would like to find out more about our not normal healthcare system and how we can achieve a normal healthcare system, please attend our next teach-in Thursday, October 30th at 7 p.m. Pacific time. We're going to be doing some deep dives. We're going to talk about what we call the model bill, which is a publicly funded system owned by the people. We're going to talk about the privatization of Medicare that is taking over Medicare, Medicaid under fire, particularly under the big, beautiful bill, HR 1, the exchanges in the marketplace, which really are money laundering schemes for insurance companies. We can talk about medical debt, which is rare in developed countries, except in the United States. We can talk about employer-sponsored health insurance, the big blue slice that covers most Americans in the US, which is actually taking its final gasp because it's just becoming so untenably expensive. And then we would love to hear your suggestions for further deep dives. This is how you can contact us. And together, let's make this happen. Thank you.